Hello and welcome, everyone. It's 6 p.m. Eastern and we're going to get started. Thank you for joining the FAAN Applying to Adult Neurology Residency in 2022 webinar. All participants are muted. For questions to the panelists, please use the Q&A feature, not chat, and we'll answer them throughout. I'm pleased to introduce our panel members for today. Our moderator is Dr. Erica Schuyler, Program Director from the University of Connecticut, Hartford Healthcare. Our panelists are Dr. Charles Flippen II, Program Director at UCLA, Dr. Emily Pharr, Program Director at Wake Forest University School of Medicine, Dr. Shivanee Sodani, Resident, University of Connecticut, Hartford Healthcare, Dr. Cheng, Resident at UCLA, and Dr. Suzan Farris, Resident at Wake Forest University School of Medicine. Dr. Schuyler, I'll turn it over to you.
Great, thank you, Lucy. I just wanted to welcome everybody. Thank you for joining us this evening or this afternoon or whatever time it is, wherever you're logging in from. I just wanted to welcome you and just really give you an overview over the next hour, give you some perspectives from several program directors as well as several residents to how to approach the process of applying to neurology residency. This panel is specific to adult neurology, and I believe there's a child neurology webinar that is also scheduled, and that is scheduled for tomorrow evening, I believe. So for our child neurology applicants, if you're with us, please join us tomorrow as well for a panel discussion with child neurology program directors and residents. So really the goal of this session, because I know that as neurology applicants, you're probably getting stressed out or feeling a little bit of anxiety at this point. The ARS system opens pretty soon. The supplemental ARS is due at the end of this week for those of you who are participating in that. And programs are going to be able to start reviewing your applications on September 28th. So all of that's coming up in the next couple of weeks. So we just really wanted to provide some perspectives as well as to answer some frequently asked questions. Now, I need to recognize NMatch, the social media group. They're very active on Twitter. They're really helpful. They post I believe a Google document that lists when all the program open houses are and the links to register, as well as a lot of program features and other information about applying to neurology residency. So I wanted to thank that group and their admins because they were able to compile a list of questions, and that's really what we're going to be working off of this evening. So they prioritize questions in terms of what applicants really want to know. The other thing that I would like to call your attention to is our virtual recruitment guidelines. So Dr. Pharr and I are two of the three authors for the virtual recruitment guidelines for neurology. We're going to be posting a link to that in the chat if you haven't reviewed it, but I encourage you to read it carefully, give some guidelines to applicants and to programs about applying to neurology this season, as well as some tips for virtual interviews. So I encourage you to read that carefully, and hopefully that will provide some guidance to you. And then I'd also want to mention that there are, hopefully will be 6 of us on the panel soon. Hopefully Dr. Flippen will join us soon, but that really these are perspectives from just a few program directors and residents. Obviously, there are a ton of programs, there are a ton of program directors and residents out there. We all have slightly different perspectives. We all may approach application review slightly differently. And our programs are different. So really one of your jobs in this whole process is to kind of figure out what's your best fit. You know, where do you you get the vibe of a program and where do you feel like you would be really happy to train in this next step of your career. So it's a really exciting time. It'll give you a chance to really meet and interact with a lot of different faculty and residents on your interviews and hopefully start to really build a network within the neurology community. So on that note, I would like to get into some of the questions. Hopefully we'll have time for some of the Q&A ones, but our panelists will try to type answers if they can. The first thing I'm going to do is some of the questions that are really more specific to program directors. And then in the second half of the session, I will direct some questions that are really more important for our residents to provide perspective on and direct those questions to them. So to start off, I'm going to ask the first question to Dr. Pharr, and that is really about application review. So as a program director, as an experienced program director, can you tell us a little bit about the review process? And that process involves looking at multiple factors. So if you can talk a little bit about, from your perspective, how programs are looking at applications, what is holistic review, and how do programs look at things? Do they have cutoffs? Are there certain years from graduation? How do you look at things like research and leadership? Sort of, what's a general approach that applicants should know about how programs are reviewing?
Yeah, I think that's a great question. I'll try to answer most of those. So we do all try to approach applications with a holistic review. And I know you hear that term and sort of like, well, what does that really mean? What that means is most of us try not to focus on one aspect of an applicant's profile. So in other words, we want to know about the person as a whole. We want to know about extracurricular activities. We want to know about performance on rotations. We want to know about letters from people that know applicants really well. And we just want to learn about the person behind the application. And so no one number or score or test performance really gives a good representation of that whole person. With regards to cutoffs, there are some programs that have time from graduation cutoffs. And so if that's a question you have, I encourage you to reach out to specific programs. The coordinator should be able to share sort of what those cutoffs are for specific schools. Some training programs don't. With regards to scores, I think that most neurology programs don't have a hard cutoff with regards to scores. And of course, our availability and the ability for us to see scores is changing, sort of over time. And so one approach often that I think a lot of program directors take, and I myself take, is just to do a quick review over the entirety of the application. And I look first at things that the applicant highlights as being important about themselves, experiences that they had, research experiences, work experiences, hobbies, just putting together a picture of what that applicant enjoys, and then filling in those gaps with regards to performance in those things. So if a letter of recommendation tells me a little bit about how they did in a research experience, or a grade or comment on a rotation tells me how they did, as a part of a team, then I look at those as well. So again, hopefully piecing everything together to give us a good idea of what the person is like through that application.
Great. That's a great answer. So, and I think, as I mentioned about perspectives, programs might weigh different aspects of the application differently across programs. So there may be some programs that are very academic or research oriented that are training a lot of clinician scientists, for example. And for those programs, it's possible that the research component may be something they're looking at because they're looking for evidence that this is a potential resident who is very interested in that track. And there are other programs that are maybe more sort of have tracks more towards practicing in the community or general neurology, or, so I think, and it may not be research projects and papers may not be sort of what's most valuable in reviewing those applications. So I really think that's part of the process as well, both for applicants as well as programs to really figure out the best fit. It's not about sort of the name of the program. It's really about where's the best place for each applicant to train to really have the opportunities that they need after they graduate, and have a place that they really enjoy and feel connected to while they're training, where they can get a lot of sort of what they need from that program. So I think it's, it's a two-way street kind of in terms of you researching programs as well as programs reviewing your application to kind of see what, the applicants that may fit best and be happy and be successful in the different programs. So I think that's really important to think about, and that there shouldn't be one single number. So one of the questions was about step 1, pass fail. That really shouldn't make a big difference if there's a score or not. I really don't think that the numerical score on step 1 is something that is really being strongly considered by anybody. And we all knew this was coming too. So I think, step 2 is a little bit more just sort of relevant to clinical knowledge anyway. So I don't think any of us are missing step 1 scores too much. And then a big question is, how do you determine how many programs to apply to? And if you apply to a lot of programs and then get a ton of interviews, how do you know how many programs you should interview at? So I'd like to make sure that everybody is reviewing the virtual recruitment guidelines. Dr. Fharr, Dr. Schneider, and I put a lot of time into making sure that there was accurate sort of evidence-based information in terms of the number of programs that applicants need to apply to and interview at and rank in order to be successful. I'll give an example first. So for example, the US MD grads, close to 100% of them matched. So it was well over 95%. And the lowest any of them went on their rank list in order for all of those applicants to match was 9. So, you know, that's sort of the, you know, the number we're talking about in terms of the number of programs that needed to be ranked. Obviously, that's not taking into account every factor. And that information is available. So there's also information available for USDOs as well as US IMGs and non-US IMGs in terms of the match rate for the different categories of applicants. But overall, when we review the information on average, we recommended that you should probably be ranking somewhere in the order of 10 to 15 programs on your rank order list. And so I would say that, you know, that's something you should probably discuss with your mentors in terms of number of program applications, but I really don't think you should be applying to every program. We're not a certain competitive surgical subspecialty. And most, for example, US MD grads probably can apply to 20 or less and be successful. So really, you know, researching the programs up front before you sort of send out a bunch of applications is important. And then for our non-US IMGs, which they have a lower match rate than our US MD grads. I think it's really important as well to sort of review the characteristics of the different programs. And we'll get to that a little bit more later. But also the match rate was quite high. So for the people that were getting interviews, also I believe that the lowest for the applicants that were non-US IMG who matched, the lowest they went on their rank list, I think, was 16. So we're really not talking about needing to rank, you know, 100 plus programs or even 50 plus programs. So I think it's really important to make sure, and that's important for programs also. If we get way too many applications, then we're not actually sure who's really interested in our program. So we want to make sure that the applicants are kind of reviewing and applying to the appropriate number and doing the appropriate number of interviews so that kind of everyone gets a chance to have the interviews and to, you know, really have a fair shot at figuring out which program is for them. So that's how I'll answer. Dr. Pharr, do you have anything else to add about the number of applications?
No, I think that covers it really well. Yeah.
Okay, thanks. So hopefully that's helpful. And then I'm going to direct the next question to you, Dr. Pharr, about sending emails expressing interest in programs. So do you think you could quickly mention a little bit about advice to applicants who are interested in programs about communicating with program directors via email?
Yeah, for sure. And there's actually a bit of this addressed in the consensus statement as well. So we've got the link there in the chat, and I want to encourage everybody to sort of review that. This is touched upon a little bit, but the important thing to remember is that program directors do not expect email communication from applicants. It does not enhance or take away from your application as far as the outside communication, you know, outside of interviews and formal communications around the interviews. So that is not expected. If you want to send an email and ask a question of the coordinator, ask a question of the program director, or express interest in the program, the flip side of it is that we are asked and required and obligated not to send any communication that is disingenuous and might sort of sway an applicant's feeling about where they might fall on the rank list. We have to be very careful and cautious because we want our applicants' rank list and choices with regards to where they train to be very true to their own feelings and not swayed one direction rather by our communication. So don't feel offended if you get a very brief thank you so much for your email as a response from a program director. Most of us are trying to be very careful with regards to our communication outside of the formal ARIS related communications, and also know that we don't expect it from applicants. So that's not something that really impacts your application for us. Dr. Schuyler, do you have a different thought or an additional thought?
No,
on that?
I totally agree. Additional emails are not needed. If you're applying to the program, that means you're interested in your application being reviewed. Or at least I hope that if you send me an application, that means you're interested in my program and you would be interested in interviewing. And then if I offered an interview and then you canceled it, then I would invite somebody else. So that's really how it works. I think program directors, we're really busy people. And so we love medical students. We love neurology applicants. Like we love doing this. But it can be overwhelming to get a lot of emails. So particularly, so, so I'd be careful about what type of things you're emailing to program directors as well. If it's very basic information that can easily be found on a program website, I don't think you necessarily need to email a program director, very basic questions where the information is readily available. If you have a specific question, you really can't, find the answer to your specific circumstance, email the coordinator plus the program director, and hopefully we can answer your question about that. Also, general interest. I've gotten a lot of emails recently saying, I just wanted to let you know I'm interested in your program and I'm going to be applying. So that actually, I don't think that's necessary either. I know people are really excited. There's some anxiety there. You really want to make sure that you're, having making a good impression. But I think a lot of those emails, a lot of us program directors are gearing up for the season. A lot of us have a lot of clinical duties that we stack up right before program applications come to review. So I think if you send emails like that and the program director is just not able to reply, that doesn't mean they're not interested in you applying, but we'll review your application when we receive it through ERAS. So that's kind of my 2 cents on that. So I'll go to the next section of questions that was submitted by NMatch, and that has to do with ERAS. So the first question was, how important are the dates? So I'm just going to quickly answer that just in terms of the deadline. So the supplemental application is due, I believe, on September 16th. That's a very important deadline because if you can't submit it after that. So that's an important deadline. And then there was a question about how important is the date of September 28th in terms of having things in. So I do think that is important. It doesn't matter sort of when you're submitting it before that date. So some people ask, does it matter if I apply September 1st versus September 14th? The answer is no. Programs can't tell which of those dates you uploaded documents. We can just see everything that is available for us to review on September 28th is the date of September 28th is listed with the document. So, and I do think it is important that as best you can, that you should try to have a complete application uploaded in time for that September 28th start for programs to review the applications. Many programs will download all completed applications on that day to really get into the process of reviewing and inviting applicants. And so if your application is not complete for that first set of sort of downloading a bunch of applications for reviewing, then it potentially could put you at a disadvantage if they're sending out a ton of interviews in that first round of review. So it could sort of delay significantly when your application gets reviewed. So I would try really hard to get things in the best you can in time for that September 28th deadline. Next, in terms of ERAS, I'm going to jump to a question about letters of recommendation. So Dr. Pharr, if you could address the question of sort of the number of letters, who should they come from, and do some programs require departmental letters? It's sort of as internal medicine does.
So I think my most common recommendation to applicants is make sure that your letter writers know you fairly well. We can tell when you've worked with someone for an extended amount of time and they really know who you are. And we can also tell the letters that are fairly superficial and they're just sort of reciting what's on your CV and your application. The letters that really tell us who you are and how that person really knows you are really much more impactful. Having said that, I do think it's important to have letters from neurologists, because I do think that's a good way to sort of judge whether or not you understand the field and you've really worked with folks who are doing the job. And so you get an idea of what the, what the specialty looks like. It is also okay to have letters from, internal medicine faculty with whom you worked, or a faculty member with whom you did some research that might not be in neurology per se. But I do think it's good to have a majority of letters from neurologists, and even in different settings. If you had an opportunity to work on an inpatient setting or an outpatient setting, highlight those with your letters as well. But if you can't achieve all of those things, really the most important thing is make sure your letter writers can really speak to who you are. And it comes through in the letter that they know that they've worked with you and that they really can say with all certainty that you'd be a good applicant.
Yeah, so I agree with Dr. Pharr in those recommendations about the letters. And I think most programs do not require a specific departmental letter or department chair letter. I've heard that there are a couple that do list that on their website. But when they say departmental letter, it can also be from like a program director, a clerkship director, or somebody in an education role. It doesn't have to be a department chair. But I think for the most part, we're really just looking for, clinical letters from various attendings. Hopefully, at least one or two of them are neurologists. So I think that that's probably the basic recommendation I have for that. The other question that came up about the ERAS is in terms of categorical versus advanced slots. So I have a categorical program, so I'll try to answer this the best I can, but I think that for programs that have both categorical and advanced positions that both are listed, there was a question about how do I approach that? And I think if you're not sure, if it's not explained on their website, what they're recommending to do, since there's two types of applicants that they will take, is to contact the coordinator and double check if you're not sure. And I would say that if you're not having any information about it and you're not sure what to do to check off both, that you're applying to both, I think that couldn't hurt. So just to answer that question about programs that offer both categorical and advanced slots. So next, I'm going to get to the sort of hot topic of the year for virtual recruitment, which is supplemental ERAS, since that is new this year for adult neurology programs. This is new for all of us. So this is new for the applicants. This is new for all of the program directors. We've never had this section before. So, so we'll get to that part next. So Dr. Fharr, can you talk a little bit about sort of how program directors are going to be using this for information? Is this a screening tool for interview invites? Will it be used for determining final rank lists? Or, how will these, sort of how does the whole thing work in terms of how a program director is going to review this information?
Yeah, for sure. As you said, Dr. Schuyler, I mean, this is new, right? I mean, we're kind of getting used to all this new information that's going to come through with the supplemental application. I think we're all really looking forward to it. I think we feel like this is going to help us get to know our applicants a little bit better. And the way I'm going to use this, and I think this is true for all program directors and is the recommendation from the AAMC, is that the signals indicate interest with regards to interviews and will not be used to impact ultimate rank list. Because of course we recognize that when you go through an interview process, you might like a school better than you originally thought, or you might not feel like a program is a good fit for you like you thought. And so we want to be sure that that the signals are not binding, and that really the signals are just sort of a, hey, I'm interested in your program in a special way for interviews. And then after that, the interviews and the rank list fall the way that it always has. So the signals are right up front and don't impact the ultimate rank list. Same thing for geographical preference.
And one of the questions was, what advice do you have for students who may be very interested in more than 3 programs, because they have 3 signals?
Right. So the number of signals was interesting. It's different for each specialty. And we were advised as a neurology specialty group that 3 would be a good number based on the number of programs left unfilled and the number of applicants who didn't match in prior years and how successful the match generally is for everyone involved. And so the number is small, and the number is small purposefully because we recognize that if programs don't get a signal from an applicant, we know that there were only 3. And so applying to a program, as Dr. Schuyler said earlier, is really your best indication of your interest in a program. That's the way to tell us you want to get an interview, is to apply to the program. And the signals just add one extra layer to that. If you're interested in more than 3, you have to choose 3, unfortunately. And so in that moment, whichever programs you're the most interested in, don't overthink it. Don't try to strategize. Just send the signals to your 3 favorite schools at that time in this application season. And we recognize that that can change as you get to know the programs and interview. Just send your top 3.
So thanks for those answers. I'm going to agree with you on all of that. So I think, especially the advice for not overthinking it or strategizing. So really the whole, and I'll address the question as well, as how do programs intend to use the supplemental application in the review of applicants? So I think it's additional pieces of information. We talked about holistic review.
Mm-hmm.
We have multiple data points and the idea of having these additional pieces of information that we're going to have available to us for people that complete the supplemental application is that it'll just give us some additional information to help get to know the applicant better through that meaningful experience section, to get a little bit more detail maybe about some of the experiences that maybe sort of a line item or a very brief description in the CV might not do that justice in terms of how, if there was something that was really important to you and that really affected your, decision to want to become a neurologist or something like that, or a really meaningful experience, whether it's community service or teaching or whatever it is, it helps. It's maybe some information that will help us to get to know you a little bit better through your application. And then the signals and the geographic preference are really to just help give us more of a clue of who's really interested in coming to our programs. You know, I think we were meeting as program directors, and one of the things that comes up is like, I hope that I get a signal, you know, so I think programs are kind of, this is new to them, and they're hoping that some applicants will signal their programs. So, you know, in terms of the number, it's only 3. So we know that the vast majority of our applicants that are applying to us probably will not have signaled us. And so I don't think it's going to really disadvantage you too much. I think one of the ways it might be helpful is that there may be an applicant who, you know, both the geographic preference and the signal could help. So if somebody has grown up and trained and done their medical school and all the rotations in somewhere that's nowhere near the part of the country where my program is, and there's no indication on their CV that they've ever been there, but then they go ahead and signal my program and then put a geographic preference for my region of the country and put a little paragraph there saying my whole family lives in Hartford, Connecticut. I really want to go, you know, I would really like to move closer to them, you know, et cetera. Then that actually gives me information that if I didn't have that information, I might, you know, not gauge that applicant as being like a high probability of wanting to relocate from wherever that's far away to where my program is. So I think we're hoping that will help us a little bit. And I think, you know, I've gotten questions in other webinars as well about the geographic preference, like, you know, what gives me a better chance at matching? And that's not really how you should be looking at it. Like, it really should be, if you are willing to move anywhere and you do not have a preference of where, then put that, that you have no preference. And, you know, but if you have a specific preference because of a certain reason, family member, friends, connections, some, you know, your best friend goes to that program, whatever it is, you know, I think having that additional information kind of explaining that situation is helpful for you to kind of express that preference. So I would, you know, really go with accurate, honest information as opposed to trying to strategize. Okay, so then the next thing, and I want to make sure we have time to get to our residents and answer some of those questions, but I'm just going to go to the next section, and I'll direct this to you, Dr. Fharr, just sort of what are some ways that applicants can demonstrate a strong interest in neurology?
That's a good question. There are lots of ways to do it. I think one I had mentioned earlier was just showing that you have some experience working with a neurologist. You know, there was a question in the Q&A earlier about, do letters have to come from an academic environment? And my response to that was not necessarily. You know, if you work with somebody who's a neurologist in a community setting, then that shows that you have an understanding of what that job looks like. If you work with a researcher who's researching in an academic environment, that shows that you know what that job looks like. So I think that's the first thing, is that you have some experience in the field in whatever form that takes. Your personal statement is really a big way to share that with us. That's really the opportunity to show us where this interest in neurology came from. And then the written sort of comments and performance on your neurology rotations, and rotations that are similar and aligned with neurology is also a really great way to show us how interested and involved you are in the field specifically.
Okay, great. Well, thank you. I think, you know, that's one of the important things as neurology program directors, that's probably the most important thing about your application, is that you're able to demonstrate and explain to us why you're interested in neurology, and that your activities on your CV reflect that interest. So it doesn't mean, and so some of these questions, just to follow up, are, you know, how much is research weighted? How much are volunteering versus leadership? How is all that weighted? And like I said, I think that it really varies from program to program, depending on sort of what the values and the different tracks and the training pathways are in different programs, and sort of what type of career tracks their strengths are in training different residents. So, you know, I don't think there's a specific, and you know, I think really the idea is that, at least from my perspective, that we have a diversity of interests coming into our program. So I don't want all of my applicants to be interested in exactly the same things. I'm reading the application in kind of from a viewpoint that I want to make sure that you're really interested in neurology, and that I can tell that you are a strong clinician and a good human being from reading the application, from what I can, you know, tell from it. And also usually from reading the essay and from reading the other sort of more descriptive portions of the application, is this somebody that I would want to meet and have a conversation with in terms of their interest? So I'm inviting people to interview who I think are not only, you know, sort of strong applicants in terms of different components of their applications, but just really to get a good mix of people and diverse interests and backgrounds and training pathways, to really try to put together a good mix of residents. And I think that's one of the most important things about a program is that, there's really a diversity of different types of residents who are interested in different things and excited about different things and are going to take advantage of different types of opportunities that are offered within a residency program. So I think, that's kind of how I'd summarize how things are weighted, and it's going to be different from program to program. So the next one, Dr. Pharr, I'm going to direct to you, is regarding away rotations, virtual away rotations, and how important is doing any of that.
We don't require any away rotations. And I think that, I always hate to speak for everybody, but I think that's a pretty common feeling amongst neurology program directors, that away rotations are not required. Certainly they became really difficult during the COVID era, and we recognize that. And some places offer virtual rotations, which is cool, but definitely not a requirement as far as we're concerned.
Okay, great. Thank you. And then I think I got through most of the first page. We have 2 pages of questions from NMatch. And the next few questions are just regarding a couple of questions that are specific to non-US IMG applicants in regards to how important is US clinical experience, what types of opportunities would be considered to be US clinical experience. So I'll just quickly address that. I think over the last couple of years, we have seen a lot of applicants really making the best of the travel restrictions. So we all know that non-US IMGs make up a large portion of our resident of our residents across the country. So it's between 1/4 and 1/3. So are coming from having done medical school in other countries. So there have been a lot of challenges with that since COVID. And I think many of you probably have your own stories to do with that. But, it has been very challenging for our non-US IMGs to gain clinical rotations in the US for multiple reasons. And program directors are or should be aware of that. It's very interesting kind of seeing how these different types of clinical experiences that are virtual have sort of cropped up in the last couple of years. And I think it's, some of them, and they vary, just as if, some clinical experiences in the US probably sort of vary in terms of how a program can really tell what the trainee got out of that experience or what type of quality of letter they're getting out of that experience. I think some of these virtual rotations vary as well, but I have seen some that are definitely, associated with letters of recommendation where the letter writer is able to comment on sort of firsthand watching patient interactions between the applicant and patients over the virtual interface and watch their communication skills and professionalism, and then discuss the cases in terms of their history, anatomic localization of what's going on. So I think that, some of these virtual rotations definitely have high clinical sort of value and can provide information. So I don't want to say that those aren't valued. And I think it's great that, and so for people that have that, I think that's better than not having it. And I think, just like with all the other aspects of the application, it's really sort of holistic in terms of how can we tell from your application sort of what your clinical experiences have been in your home country, what kind of neurology experience have you had there, what kind of internal medicine experience, and kind of what information are we getting from your letters of recommendation. So I think ideally, you having a US clinical rotation is probably better than not having a US clinical rotation, but I think there are plenty of applicants who are matching, who did virtual rotations or have potentially not a specific US clinical rotation, but have detailed information coming from their medical school, or in some cases their residency that they may have done a portion of or completed in their home country. So I think it really, every situation is different, and hopefully our programs are, in their holistic review, kind of looking at all of that information as a whole. So that was really, to summarize the primary question regarding IMG specific topic. So it's a little bit after 1/2 the hour. So I really want to get to our residents so they can offer their perspective. So first of all, thank you again. So we have 3 of our residents from around the country, from Wake Forest, from University of Connecticut and UCLA, all joining us. So, you know, I think they probably have more in common in terms of their training than, you know, one would expect from being from all different parts of the country. But our programs, I think, are very similar in some ways in terms of our curriculum. There's a lot of overlap. The program directors, a lot of us really know each other very well and share resources and things like that. So I think you'll find when you're looking at programs, you'll see a lot of similarities. So I'm going to direct the first question to Dr. Farris, which is, what are some do's and don'ts specific to the virtual interviewing experience that you would recommend to this year's applicants?
I think I'm going to start with the don'ts here. And I'm actually guilty of one of them right now. So some of this from my personal experience last year. I had my dogs around, which is great. If you're an animal person, have your animals around, but only if they're not going to be distracting. And mine are picking right now to play. It's important to show up on time to these things. And it's important to look professional, have a well-lit area that looks, you know, sort of like an office. I did see people last year sitting on their beds with their laptops and their hoodies, not just at the social, but one of them actually at an interview. And that was, that you shouldn't do that. Don't do that. Don't stand up while you're wearing sweatpants with your suit jacket. I did that too. I think everybody got a good laugh out of it, but it's not a thing that you should do. When you show up to these things, whether you're interviewing or going to a social, you want to be yourself. You want to really highlight who you are and what you're about, what you represent, and don't try to feign interest in things that you're not interested in. If research isn't your thing, don't talk about research. You don't want to end up in a program that wants you to do a lot of research if you don't want to do a lot of research. Here we are. Okay. Talk about the things that you're most passionate about, because that's what's going to make you really shine with the program that's right for you. And the most important thing is geography is important, sure. Research is important, sure. The best thing that you want for your residency program is to be with a group of people who understand who you are and what you're about and want to work with you. And the best way that you can make sure that that happens is to just totally be who you are within the limits of professionalism. I think that was, I had one more note, and the only other note that I had was that if you have any red flags on your application or any gaps, if you're a non-traditional student, I didn't go to medical school until I was 31. And if you have anything that is going to be out of the ordinary on your application, feel free to talk about it. Make sure you have a good plan about how to talk about it, and be honest and straightforward and humble. That's all I've got.
Those are great points. Dr. Sodani and Dr. Cheng, do you have anything additional that you would like to add in terms of advice for the virtual interviewing?
I think I agree with whatever Dr. Farris said, essentially. And even if something does happen in the background, just like, it's okay, just get a laugh out of it and just don't sort of be panicky. And it's a way to show essentially that under pressure, how are you acting in a way, and just have fun with the whole process. I know it's hard, but yeah.
Yeah, I think those first couple interviews will be really stressful. It's just how it goes, but you'll get the hang of it. You're going to be a pro at it. I think the number one thing though is make sure that your internet is really good. I think there's nothing worse than having it cut out halfway or you're like lagging and things like that. So if possible, try to test it out before you actually do the real thing.
Yeah, those are all great points. And I think just as somebody who's interviewed a ton of people, and the last 200 of which have been on Zoom, these things come up. So, you know, distractions can come up, you know, especially if you've family members or children in the house, in your home, and you know, programs should be kind of supportive of that, and but you know, really try to minimize distraction as best you can and technical interruptions. But we know that some of these things are inevitable, So I think maybe that might be a red flag for a program if somebody's not supportive of a technical difficulty or of an unexpected challenge that arises during a virtual interview. And it really, it's surprising how well you can connect with somebody on Zoom. I think I was really surprised the first year that I did virtual interviews. I didn't know if this was going to work at all, but I found that, you know, it's not as good as in person, but we really can get a good sense of what people's interests are. And you can really actually have a good conversation with somebody in the Zoom format. So I would reassure you of that. And yeah, just be yourself and be prepared to answer questions from your application. So if you have a specific hobby, be prepared for an interviewer to also have that be like their obsession in life, and they will want to talk to you about that the whole time. So definitely, you know, be honest and be ready to talk about any of the research projects, any of the hobbies or other interests that you have, because there's a good chance that that will be a topic of conversation. It's also a good chance that somebody else will share those interests and want to and really get excited to talk to you about that. So that would be my advice as well for that. I'm going to go to the next question for our resident panelists, and this question for Dr. Sodani, which is, what are some characteristics of a strong residency program that applicants should be considering? Sort of what aspects, you know, in sort of researching which programs to apply to? How do you go about that? What are some things you should be looking for?
I think some of them were already sort of mentioned during this hour, but essentially, obviously, like if you have family around, any geographic preference, that is obviously the first thing that you would want to look at. The second would be like subspecialty exposure within like neurology. But most importantly, at least when I was sort of researching programs and even interviewing, it was like, you really want to see how the people are, like the faculty, residents, and how are they getting along. And you essentially get a vibe from the residents that how do they actually feel about the program, and are they really happy? Essentially, it's not about being in the best program in the country. It's more about what is best for you and how do you benefit by going into that program, and how does the program benefit essentially from you too, in the same way, because you want to go to that place essentially and be there for like 3 to 4 years and grow there, mature there, become the best neurologist that you can. So it's trying to pick the right fit for you more than trying to go for the best sort of place in the country, I would say. Yeah.
Okay, thank you, Dr. Sodani. I'm multitasking. I was trying to type some of the answers in the Q&A at the same time. It's hard to do both. Just to kind of follow up on that, specifically for our international grads, are there any additional pieces of information that you would advise?
Sure. So as an international medical graduate myself, obviously I was like really anxious before applying, and none of like my seniors had ever applied to US before that. So obviously I didn't really have a lot of guidance. So what I did essentially was obviously go online and stuff, and you can look at the program, look at the faculty roster, look at the current residents, and see how like what is the percentage of the international medical graduates within that program, and essentially you can decide if that program is like more IMG friendly or not. And that goes for like if this program is more family sort of friendly or not as well, when you're thinking about like maternal leave, paternal leave, things like that. So you can look at the program, talk to the residents when actually interviewing, and I think you can sort of get a vibe of it, similar to what I said previously. Yeah.
Yeah, thanks, Dr. Sodani. Dr. Farris and Dr. Cheng, anything that you would recommend additionally for the applicants when they're kind of trying to look at programs and trying to sort through them and pick which ones they should apply to?
Yeah, I think that, you know, like we we're talking about before, most programs in terms of the training, it's probably going to be about the same. Some will be a little busier, some would be a little less busy, but overall the training in America is very standardized. So no matter where you go, you're going to get a great education. This is what I tell every applicant, that you'll be fine no matter where you go. Where I think it differs a little bit is just in the culture of the institution. And that's where I think, you know, going to the happy hour is so important. Like the Zoom, I know it's Zoom, it's not as fun, but it's like a great chance to just kind of see how the residents are getting along and like if they like each other, because I remember as an applicant definitely going to some of the pre-interview dinners, you could tell that they did not like the program, and that was a huge red flag. So, you know, it's really a good time for you to assess the program as well.
I think that I would echo what you said, Dr. Cheng, but as well, I think there are a couple of differences in training that can occur across programs. There are some programs that don't have an inpatient service, they're consult only, and so that will change your experience. There are other programs that don't have a neuro ICU. So if you think you might want to do be a neurointensivist, then you might want to look at programs that do have a neuro ICU and think about how that's structured. But these are just sort of, you know, technical aspects of programs. So think about what you're interested in long-term and try and get the fullest experience that you can from a program. Make sure there's a wide representation of subspecialties and a lot of faculty who are there to support you.
Yeah, I think that is all excellent advice just in terms of how to sort through. And I know from the program perspective, we've really, I think programs are really trying to do their best to keep their websites up to date and try to, you know, sort of display their programs online so that applicants can kind of get a sense of maybe who some of their residents are, try to put like resident profiles on their websites and on their social media. So you can kind of like, you know, sort of see where people are from and what their interests are and kind of what their perspectives are if they have testimonials just in terms of like what they like about their program or what they like about that geographic region and stuff like that. You know, some programs have made videos of, you know, sort of trying to do a virtual tour of their hospital. So I think programs have really stepped it up in terms of what's online compared to before this was virtual. So I think the more you can review the program information, particularly if you have an interview coming up with a program, if you do apply there and you do get an interview, I think the more you can kind of review and familiarize yourself with the program and really be able to generate some questions about things that you're not sure about after reviewing the materials. I think that those are things that will help you get more out of your virtual visit. Dr. Pharr, do you have anything to add? I just, you know, about the virtual interviews or kind of how people should be reviewing things online?
I don't. I mean, I think this has been just really great advice. It's always good to hear it from the recent applicant perspective, right? I mean, I think this is really great advice to share. I do think a lot of resources are available online. I guess I will say too that sometimes keeping up with what's online and you know, like Dr. Schuyler said, the videos and all the offerings and the Twitter posts and everything, you know, it falls on the program directors. And so if you're not sure if something is current, if you're not sure if this reflects a program that you understand the program to be, interview is a great opportunity to clarify those things and just say, I saw this on your website. Is this still the structure of your block schedule and things like that? So just know that what we display on our website and the things that we offer are just sort of a glimpse, and it's a dynamic process, this training, you know, these training environments. So ask those important questions during the interview for sure.
Yeah, so that's all, I think, great advice. And it also leads us into the next question really well. The next question I'm going to direct to Dr. Cheng, which is, what are some of the things that would be important to ask when you come for your interview virtually? What are some things that would be important to ask the faculty versus what are important things to ask the residents when you meet with them?
It's a great question. I think that what questions should you ask the interviewer is always something that I struggled with. I think that one of the things, because sometimes you get your list of interviewers ahead of time and you kind of can look into what they're interested in, you can target a little bit towards what brought them there. I like to personally ask my interviewers why they chose to go to this particular program and what drew them here and what made them stay. So I think it really gives an eye on what kind of personal factors drew them to this program. As for the residents, I'm just going to plug like the happy hours again. I think that, you know, a lot of times applicants get very nervous during these happy hours or these like Zoom get-togethers, but it's really truly just for you guys to get to know the program. The residents there are not judging you. They're not going to be writing any kind of evaluations. They're too busy for that. It's hard enough just to get them to attend these events. So really it's just for you, ask all the questions you want, try to get that flavor of like, you know, what the culture of the program is like. Really ask those questions, especially the ones you're scared to ask faculty. It might be a good way to ask these questions before you get to your interview and you have some fodder to talk about during your interview the next day. So I really cannot plug these like the pre-interview dinner happy hour enough. You know, we're really trying to put our, you know, foot forward too. So it's a good way for you to judge us on how we're doing.
Great, Dr. Sodani, Dr. Farris, what additional information would you want to tell our applicants about sort of what they should ask faculty, or what kinds of things they would want to find out from the residents?
I think I would say one other thing that you can ask the residents or the faculty essentially would be any changes that they would want to make with the program or make within the program itself. And the other thing for residents specifically would be, do they have any say like with the program leadership, and do they include the residents? I think that is one other thing. The additional thing I think, which is I obviously recently finished like fellowship interviews, and it was, so you can have like longer days, and towards the end of the day, you don't have any questions left. And that's okay. It's okay if you don't have any, because it's the entire day that you go through the questions with like each interviewer. And then obviously, like previously mentioned by other panelists, that there's so much information available online, right? So it's okay to not have a program specific question, at least from my perspective that I'm saying. And Dr. Pharr and Dr. Schuyler can sort of mention and whatever they think. But essentially, like towards the end, if you don't have anything else to talk about, I think you can talk about like non-neurology stuff, non-program specific stuff. I think I had my fellowship where I matched, and my residency program where I matched both of the program directors. I think my conversation was essentially not regarding neurology. So the whole conversation, so.
I once had an entire conversation with an interviewer about impulsively looking at real estate online with no intention of buying it. It was a fantastic conversation. And so I'll just echo what you said, Dr. Sodani, that it's important. It's important, I think, to connect with people about things that are not neurology. I think some of the questions that I asked residents were, you know, do you feel supported? And do you feel like you can communicate with your leadership? And also, what would you change is a great one. But I don't think I have anything additional to add.
Yeah, I think those are really, I think you all made really good points about those are important things to mention. And I'll just say, I do try to leave time towards the end of the interview. So in case the applicant does have questions, if they don't, I'm able to fill up the time chatting about stuff. It's not a super long time period to do an interview. But also if the applicant is seeming either sort of fatigued, it's getting towards the end, or it's a couple minutes early, sometimes I'll just end the interview like before the last, last warning, you have to switch now, time signal. So, and either way is fine. I think probably one thing that wouldn't be as appreciated by an interviewer is if you really don't seem interested at all in the interview. So as long as you are interested and engaged during the interview time, it's okay to not have questions. But if you really just are not engaging with the interviewer and seem disinterested throughout the whole time period and then have no questions, then I think that might not make the best impression on the program. And if that really is the case, that if you're really not interested in that program, then that's probably somewhere that you should probably cancel the interview and give somebody else the opportunity. I think for most programs, there are a lot of applicants. We're not able to interview every single person that is interested in interviewing with us. And so if you get an invitation somewhere and you're kind of so, or you're just done, you've interviewed at a whole bunch of programs and you're ready to not do any more interviews, then cancel the rest. And there are people that really, this might be their dream program and they're on the wait list. So that's probably something that would make me a little bit more upset if somebody came to the interview and really wasn't interested, because I know there's probably people out there and I can't tell until I meet you if that was the case. So I would definitely encourage you to kind of think carefully about where you really want to interview once you get all of those invitations. and also to have good etiquette at all times. So all of your interactions with the program contribute to the overall impression that you're making. So you want to make sure to be polite and timely in terms of your responses as well, and as well as if you are going to cancel an interview or need to change it, to make sure to be sort of polite and respond promptly with the coordinator. The coordinators are not filling out an evaluation for each applicant, but if there is somebody that was rude to them or somebody that didn't seem professional in their interaction with the coordinator, believe me, the coordinator will tell the program director, because that's not somebody the program coordinator is going to want to be interacting with for the next 4 years. So I think, make sure that you're always on your best behavior, regardless of who you're interacting with. And that goes for when you're, working clinically too. You always want to, maintain that professionalism. So I think, I'm just going to, because we're at 6:55, there were so many great questions that we were able to get to from NMATCH and kind of answer some in the chat, that I just really, in our last couple of minutes, if each of our panelists, I just want to see if you can just sort of impart one final thought to our applicants or a word of encouragement to them. And we can do that to end off the meeting. So I'll go to Dr. Fharr. I'll put her on the spot first for that, but any just general words of advice or encouragement for our applicants this year?
I think with regards to interviews, just have fun with it. I know the Zoom thing is a little bit awkward in the beginning, but like Dr. Schuyler said, you really can make a connection with somebody and really just look for that connection and have a fun conversation and really just try to enjoy yourself through the process. It can be very stressful, but when you realize that the person on the other side of the screen is a person too, and we're just kind of all in this together trying to get to know each other, I think my advice would just be, to have fun with it and prioritize your goals and your needs and make sure that you're matching those up with the programs, not just trying to impress, but you're also just saying, hey, is this a good fit for me? Because this is really more about you all than it is about us. So I think having that experience where you're really making sure that you're looking for that fit, for that click with the program and just having a good time.
Great. Thanks, Dr. Fharr. Dr. Farris, what words of advice would you like to leave our panelists with, or our applicants with?
Be yourself, be polite, but don't worry about being weird. All neurologists are weird. So if you have strange hobbies, just go for it, enjoy it. And you're going to meet a lot of really interesting people, and you're going to make friends on the interview trail, even on the internet. So have fun.
And most of us love dogs, just for the record.
Yeah, I think that there have been some of the Zoom social hours for our program where people brought their pets. I think I remember, because we actually have quite a few residents who have cats. So we're not a cat specific program, but there are definitely, at least last year, there were a lot of cats at the meetings. I have guinea pigs. They're squeaking right now because they want vegetables for dinner right now, and I can hear them. But everybody's got their own, like Dr. Farris said, a lot of people have very unique and interesting hobbies. I remember one last year, our chair, Dr. Greenfield, is a lute player, and we had an applicant who was a lute player, and he was just like over the moon excited to meet this applicant and talk about their shared interest of the same musical instrument. So, so I totally agree. Dr. Sodani, any last words of advice?
I think it was all covered by Dr. Farris and Dr. Fharr. But yeah, be yourself, have fun. It's scary in the beginning, but you just have to understand that we're also people on the other side. Program directors are too, and everybody's just trying to find the right fit. So yeah.
Great. And Dr. Cheng, do you have any last words of advice before we close the meeting?
I'm just going to say that, you're going to be fine no matter what. I mean, any program you really end up going to, you're going to make the best of it, that there will always be good things and bad things about every program. Yes, optimize, try to look for that best program possible. But, in the end, you're all going to be neurologists. You'll all be, one of our colleagues one day, and you'll be great.
Great. Thanks so much. I wanted to thank, before we close, I wanted to thank NMATCH again for sending us some great questions for us to address. I also want to thank Lucy, as well as the AAN staff who have helped provide this platform and support this event tonight. And I wish all of you the best of luck and have fun and be yourself. I agree with everything everyone said. And I hope you all find your dream program that is the best fit for you. All right. Thank you, everyone.